Hi, everybody. Welcome to GW, Center for Integrative Medicine Zoom channel. I'm your co-host, Dr. Kogan, Medical Director, CIM, and Associate Professor of Medicine at George Washington University in Department of Medicine. So Elisa Parker, one of our long-term subscribers, sent me a really interesting link to the publication that was just done yesterday in the Nature journal, saying that there's a growing evidence of using different vaccines, particularly in the case of this article, Zoster vaccine to decrease risk of dementia. So we, of course, already have been talking for quite a long time about different infections increasing risk of Alzheimer's disease, specifically talking about viral infections, but also infections in the mouth, whether these are chronic cavitations at root canals or abscesses, or even presence of certain microbiome or certain pathologic bacteria in the mouth, that pieces of which have been found in the brain of patients with Alzheimer's disease. So it's a fascinating topic. And in essence, you can think of it this way. Is there enough evidence to, if you had a zoster, or if you had a shingles, or even if you don't, is there evidence to start getting vaccinated against some of these chronic viruses to see if you personally would benefit from lowering risk of Alzheimer's? So what I did is I put together a slideshow, and I'm going to walk you through it real briefly, because I kind of felt that there's definitely growing evidence. Is there enough evidence to say, okay, we should start offering these vaccines for prevention of Alzheimer's disease? So let me start from the start. First of all, what is the data for how could the viruses, and let's just concentrate on this slide for Varicella zoster, it's one of the herpetic viruses, on how pathology can create here. So what exactly happening here for the viral infections to increase risk of Alzheimer's, or actually even be one of the many causality factors for Alzheimer's disease. So the cells infected with VZV did not show many the characteristics of different plaques and tangles, but HSV1 has shown that. And moreover, the VZV, so the Varicella zoster, seemingly, especially if it's combined with HSV1, seems to significantly worsen the picture. Now, this is in a petri dish. Now, can this get translated to humans? So let's take a look at this. So there's been multiple different ways of looking at the data. So there's large groups of researchers looked at saying, okay, can we link a prior history of herpes zoster to the increased risk of Alzheimer's? So this particular study in very large cohort, I mean, you're talking about over 170,000 people and over 700 matched unexposed individuals, there was no risk. But you look at lots of other studies, and the conclusion in relatively recent publication goes like this. Okay, if you are an average person without APOE4, it's unlikely that a prior zoster, herpes zoster, or HSV1 is going to cause future chances of increasing Alzheimer's. But if you APOE4, it's seemingly the data is becoming overwhelming. And of course, you should think of it this way. Of course, it makes sense. If you have APOE4, any insult to your system that can raise an inflammatory response, chronically particularly, is going to be an additional factor. So we've established that. Now let's look at what happens with vaccinations. Can you actually give somebody a herpes zoster vaccine or other vaccines, maybe even things like tetanus vaccine or diphtheria or pneumonia, and can that decrease risk of future Alzheimer's disease? So here's one study where they literally looked in, and it's retrospective, not prospective, so there's a problem with the methodology, but nonetheless, this is one of the many studies that have starting to show us that there's potential protective impact. So this is a very large study within the Veterans Affairs system in US. You can look at the fact that they looked at over 100,000 veterans in a period between either 2011 to 2020, 2012. So just a couple of years, but they looked at the all of the VA system, and they saw a pretty significant difference. So if you've been vaccinated, then you had a significant protection. Let's look at another. So this is a UK, so this is different. This is not US study. But again, this is a little bit better study because this is what's called nested case control. It's somewhat better statistical. I'm not going to bother you with detail what the difference is, but it's slightly better methodology. And again, they're seeing a pretty significant protective impact. And again, this is a pretty large number of patients. I mean, over 200,000. So this is large cohorts. Can this translate to an actual randomized forward-looking data? We're not going to see that because there hasn't been studies done like this. Of course, a study like this can take a long time. So now let's look at this. There's studies showing that retrospectively, people who receive more than one vaccine actually seemingly even more protected. So in this study is when you combine multiple vaccinations, there was an additive protective mechanism. Or additive. So now the degree of protection, this is an important point, is not massive. So we're not dropping the risk of dementia by 80% or something. No. The best results I've seen are about 35% reduction, and the average is about 20. So it's significant. It's statistically significant. It's probably clinically significant if this number is going to hold in the better controlled studies. But nonetheless, it's an important signal here. This is another observational analysis. Now, this is more of what's called a meta-analysis. This is done in China. So they looked at a lot of different analyses. So they looked at 17 studies, totaling over 1 million participants. And they again seen a significant protective effect. Now here, they specifically looked at different vaccinations. And you can see that when they combine the results, the drop was 35%. So it's pretty large. And they're actually giving you particularly decreases. So for herpes zoster, decrease was 31%. For Tdap, it was also 31%. So it's sort of like, why would tetanus vaccine prevent? Well, the tetanus probably does not, but diphtheria and pertussis may, and that component says you're not going to develop those infections or decreased chance of developing them. Again, this is all retrospective. This is very important because it's not 100% proof of anything. And this is Wales, again, showing the same story. So if you do varicella, so it's different countries. So I showed you US and Veterans Affairs, China, UK, and Wales. So multiple different populations. The results are consistent. So here you have the decrease of 28%. So we're looking at double digits. We're not looking at the tiny, statistically barely significant. So, what is all, just let's summarize this. How do we look at all this? Well, clearly vaccines have some possible protective effect. Which vaccines are better? Who knows? Herpes zoster probably could make the most sense in a way, because if you've had it before, if you had flares that are periodically raising this inflammatory response, and if specifically if you have ApoE4, this actually starting to smell like maybe I should start recommending the vaccines for that particular reason. If somebody is resistant it, I may say, look, but there's potentially additive benefit for you to get this vaccine. So clearly inflammatory response to viruses contributing to risk of dementia. I don't think at this point we've just sort of, arguing over this anymore. Are the vaccines best tools to protect against inflammation response to viruses? That's not necessarily correct. In fact, it's probably not. The vaccine's probably only one tool of many, and maybe people who are very resistant to vaccines is still not going to accept it based on just this. They may simply say, look, forget it, I'm going to do other things. And that's probably a really good idea too. Now, all latent virus infections in patients at high risk should be aggressively treated. Now, that is not an exception anymore at this point. This includes chronic mono, And so this gets to a little sticky situation. And those of you who on Recode are following Bredesen work, Bredesen is not aggressively suggesting screen for all viruses. There has been a lot of discussion about it, but I think because there's no prospective data, it's not really clear what to do with this. Because obviously chronic mono is not going to be treated with medications, as they can have serious side effects. So what are you going to do? Well, you probably should aggressively treat it with non-pharmacological methods. Boost an immune system with whatever methods you're using. Use long-term safe antivirals. For example, L-Lysine could have some significant benefit for recurrent cold sores and potentially even for varicella zoster. So, use your judgment. Consider working with a provider who's very familiar with this topic and can strengthen your immune system and suppress viruses by natural products or by other means. Hopefully this was useful for you. Stay tuned for what else is going on in the world of health, healthy aging, integrative medicine. Hope you have a wonderful day and stay out of the smoke. We are been hit by this crazy Canadian smoke, so hopefully it'll pass quickly and we don't get a lot of hazards for our own health. Stay safe, stay well, friends. Goodbye.